This is WVVA in Focus, a weekly program about important issues and events in the two Virginias.
Good morning, everyone, and welcome to this edition of In Focus. Today, we are putting the spotlight on health. This month, the cities of Beckley and Princeton welcomed a new addiction treatment facility. Spero Health now has locations in both Mercer and Raleigh counties. You're seeing some video of ribbon cutting there. In Beckley, Spero Health is located in one of the offices housed in Professional Park. Through both individual and group counseling, the facility will help people overcome all forms of addiction, whether it be alcoholism, substance abuse, or something else. And this clinic is there to treat anybody with addiction. It's an outpatient clinic, and they also accept West Virginia Medicaid as well, so that's very important for you at home to know. The Spero Health in Princeton is located on Courthouse Road across from Pita Pit. So joining me in the studio to share more information is Benny White. He's facility administrator. Benny, thank you so much for being here with us.
Thank you for allowing me to be here.
So I understand Spero Health uses individualized treatment plans, and they also have same day or next day appointments. They also accept walk-ins. So how does that all work with treatment plans, walk-ins, and if someone's interested and they think, they're struggling with an addiction, they need help?
I wrote a couple notes and brought them with me, but we ultimately provide patients with the golden standard of excellence. It's a plan that's tailored to them. So we meet them in the community and their needs. So we meet patients where they're most needed to be met at.
Right, and there might be someone out there who's watching who knows someone with an addiction, maybe they have an addiction. What's the first step if they feel like they need help? What should they do as far as getting in touch with Spero Health or making that first initial step?
The first initial step would include picking up the phone, calling our 1-800 number or calling our office number and setting up an appointment. Or you could come into either one of the office locations that were listed and set an appointment as a walk-in.
And also, how do the treatment plans work? Are they individualized, catered to what each person needs, what each person is struggling with? How do those plans work?
They're individualized to the person's needs and to how they need to be met. Everything that the patient comes in and needs to be met. My counselor addresses those needs, and my physician helps out with those needs and helps meet them.
Yeah, well, that's so important to meet someone where they're at because everyone has, different needs, different struggles, and there's a number for you at home as well that you can call. And there are physician services, counseling, recovery support, all available. So let's talk about those resources for folks who may need those.
Those extra resources are just a extra pat on the back for patients when they come in for thank you for coming to get support, but let's help you guys get your life set up. So let's help you with anything that you're struggling with. If you need a job, we can help you get set up with that. If you need transportation or help with your children, we can help you get set up with that. It's the extra initiative that we take to go out of our way to make sure our patients are okay.
Yeah, well, that's so important as well to follow up with them. And accountability is crucial when it comes to battling any type of addiction. So how does Spero Health help when it comes to accountability and, like you said, keeping in touch with those people and just making sure that they are on the right path toward recovery?
Spero helps in two different ways. We have a shepherd program. We follow up with our patients on a daily. Patients are split up between the team members, and we all check in on our patients on a daily basis. Along with that, patients come in with a STAR card. STAR card program implements just being consistent and coming in and just completing your treatment and doing everything the right way. We come in, you guys bring your card, and we check it, and we just, as it's completed, patients get rewarded at the end of the completed STAR card.
That's wonderful, and that's a great way for them to keep pushing forward with rewards. Now, how do those rewards work for those people?
As long as they complete the STAR card, they're held accountable with the STAR card. They turn that in to us, and we just let them pick something off our prize rack.
Oh, cool.
Yes, ma'am.
Hey, who doesn't like prizes, right? So let's also talk about drug screens and medication counts, Benny. How does that work?
Our drug screens are observed based on the need of the patient or the agency we're working with. And our medications consist of Vivitrol and Sublocade mainly. Vivitrol is an injection. Sublocade is a tablet that is taken, and we just emphasize the holistic way of treating this method of drug abuse and opioid overdose.
And as I mentioned earlier, Spero also accepts West Virginia Medicaid, so let's talk about ways people can pay, including for those who may not have insurance, because I'm sure that could hold someone back if they're thinking, I don't know how I'm going to afford this, but I need help. How can people pay for the services of Spero?
Yes, ma'am. We're in partner with West Virginia Medicaid, and we make it very easy to come in and get services. Along with that, if you don't have Medicaid, it's just $300 a month after your visit. So we make it very cost effective.
Yeah, especially if you need that help, you just reach out. There's some contact information for you at home for the Beckley office and the Princeton office, and also a website as well. So, Benny, what other cities or towns is Spero located in? Let's talk about that first, and then we'll talk more about the offices here.
Spero's also located in 2 sister clinics, the top of West Virginia, that'll be Clarksburg and Parkersburg, and that's where we're at in West Virginia.
Yeah, and then the 2 offices here in southern West Virginia, in Beckley and Princeton, that just opened this month. So why was the decision made to open 2 offices here then in the southern part of the state?
Just the need of West Virginia and how impacted that it was by drugs and opioids. So it's just, we wanted to make an impact in the community and just offer extra helping hand.
And what are the hours for someone to get in touch? Like, is it a Monday through Friday situation for the Beckley and Princeton office, or how does that work to call the number and get in touch with someone?
It's a Monday through Friday situation. It's 8 to 4:30, and we adjust by community needs. So if Beckley needs us more, we adjust to Beckley. If Princeton needs us more, we adjust to Princeton. We're truly here to help out the community.
And how's it been going so far since the offices were opened earlier this month?
It's been going great. We're saving lives and restoring relationships and instilling hope.
Yeah, that's so important too, to get people back on the right track. What else do you think our viewers should know about Spero, maybe its mission, what it represents, and the goal to help people down here?
Ultimately, that we're just an extra resource in the community, and that we're just here to make a positive impact on the community and help out. We're going to be having upcoming community fairs and events that involve just our community and not just the patients only. So we're an additional resource for community.
Right, and again, helping people with addiction, so whether it be alcoholism, drug use, you name it, you're there to help get those people back on the right path.
Yes, ma'am.
All right, Benny, I really appreciate you coming in. Is there anything else you feel that our viewers should know?
No, ma'am.
Yeah, I think we pretty much covered it. Let's give that contact information up one more time. So if you have a question, you can go ahead and reach out to the Beckley office, the Princeton office, and there's the website again and the addresses. So please feel free to call if you have any more questions, or if you know someone in need who's struggling with an addiction. Give them this information. If you yourself are struggling, please reach out and call. Benny, thank you so much for coming in and sharing some more information about Spero Health.
Thank you for allowing me to be here.
We'll be right back after this. Welcome back to this edition of In Focus, everyone. This morning we are talking to Andrea Cline. She is the youngest CEO at Tug River Health, also the first female CEO. Andrea, it is so great to have you here in the studio.
Thank you.
So let's hear more about your story in healthcare. How did it all start?
Many years ago when I graduated high school, I decided I wanted to be a nurse. So I went to BLUEFIELD State at the time, nursing school right out of high school. Challenge, to say the least, and I failed out finals of my first year. So I decided to take a whole different career path, change my majors, was too scared to go back because I didn't really know what to do at that time. So I ended up getting a bachelor's in business administration with a specialization in marketing and management. But at that time, there wasn't a whole lot of jobs open in that career, and they wanted experience. So it's hard to come out of school with a degree with no experience. So I had a young son at the time, and I knew I had to provide a life for him. So I said, well, let's just buckle down and let's go to nursing school again, because that's really where my heart was. So I started BLUEFIELD State all over again, got to finals of my second year, and was in a position where I was close to failing out again. So my whole beginning of my career was failure, you know. But I didn't give up. I pushed through. I even had an instructor say, you're probably not going to be able to pull this out. You might want to prepare to start all over again next year. And I wasn't going to let that defeat me. So I passed my finals, passed my boards on the first try, despite low predictor scores. We did predictor testing that says, you know, you're going to fail or pass, and passed my boards first try, and I went straight into the ER at Bluefield, and that's where I started my career in nursing.
Wow, that's incredible. Let's talk more about perseverance and how you were told, Andrea, you might not make this, you might want to think of something else. What was it inside of you that said, you know what, no, I'm going to keep pushing?
One, I knew I had a son that I had to take care of. He was 18 months old when I went back to nursing school, so that was a big driver for me. But two, I wasn't going to let it defeat me a second time. You know, it got me the first time. It allowed me to step away for 4 years and do something else, and I knew that's not what I wanted. I knew I was meant to be a nurse. So I buckled down, and I had a lot of good friends in my nursing program, and we got a study group together, and we trucked on through.
Where did your interest in becoming a nurse come from? When did that start?
I come from a family of healthcare providers. My uncle is a physician in the Beckley area. So I grew up watching him practice medicine as a small girl. I remember going to some of his residency rotations with him. My aunt would pack us a lunch, and he would sit me in a conference room, and you know, I would go to work with him when he was a resident. I watched him graduate med school as a young girl. My mom is a respiratory therapist here at Princeton Community. So I went to work with her when they had Take Your Kid to Work Day. So I watched her do that. She also does some work in cardiology, so I've gotten to see her do all kinds of things. So it's just in our family, it's our nature, and I just knew that's what I was meant to do.
So once you actually did become a nurse, let's talk about your journey when that started.
I went straight to Bluefield as an ER nurse. Orientation was tough. And my first few days off of orientation, I was put out there alone and had to experience some pretty hefty, traumatic things. And so I learned to sink or swim really quick. Amazing physicians that I worked with at Bluefield that are still in the local area, you know, molded me. Great nurses that I have since worked with as providers. They became providers and came to work for me. So it was a great experience.
What was the most challenging thing for you when you were first starting out that you said it's sink or swim? So what made you decide, okay, you know, I got to keep going and, again, persevere through that career?
I had lives in my hand. You know, working in the ER, you never know what you're going to get. And I've had a lot of situations where I was my patient's advocate and their life depended on me. So you have to be confident in yourself and know that no matter what you're faced with, you know, you can persevere through it.
So what led you to Tug River Health?
Again, my children. I was pregnant with my daughter and had a complicated pregnancy that led me to be out for a little while and not able to do emergency medicine. And I had to provide for my family. So I began looking for jobs, and Tug River had a posting on Monster for a director of quality management. The only requirement that they wanted and that I had was an RN license. So it was a director of quality management and a director of human resources. I had no experience in either, but I decided to apply, and I was selected out of 6 other qualified applicants who had experience. So I went into this job not knowing a lot, but knowing that I could do it.
Right, and the willingness to learn,
Yeah.
right, and to be teachable, that goes a long way in any career.
Yeah, and a lot of self-education. Like, I had to teach myself a lot of things because there wasn't anybody there who that did the job before me to teach me.
So what year was that you started at Tug River?
2014.
Okay. Yeah. So let's talk about the journey from when that happened all the way through becoming CEO this year.
Yeah, so I started in Tug River in 2014 as the Director of Human Resources and Quality Management. Learned very quickly about federal reporting, what the feds require of us, because we're an FQHC, so we get funding from the feds to provide discounted health services to the patients in our community. And not everyone understands that. So that was a challenge for me, understanding that process and understanding that we had to do certain things that normal physician practices don't have to do. And then I just continued my education. I went to school and got my master's degree and did that working full-time with kids and sports. And I did that in 16 months. I did a fast track program, which was a lot with my family. I got to do a lot of cool things. I was, in 2018, I was named one of the top 40 nurses in the state of West Virginia under age 40. I've been selected by Governor Justice to sit on the board for the West Virginia Center of Nursing, which I still sit on with one of my previous nursing instructors, which is, you know, interesting getting to do that with her, that whole role reversal, you know, student to now colleague. We transitioned my title to Director of Operations at one point, which included HIPAA compliance, risk management, several other things. And then I finally became Chief Operating Officer several years ago. So that still incorporated a lot of my old duties, a lot of new duties. We just kind of kept adding responsibility on, and I've learned a whole lot. Our previous CEO, Tim Crofton, he taught me a lot about being an administrator. You know, I have a management degree, but actually putting that into practice when you supervise physicians who are older than you know, when you're young and inexperienced, that's a little bit of a challenge. So I learned a lot from him over the years. And then upon his passing at the beginning of the year, the board, they opened it up for applications, and they chose me to be their new CEO.
Well, congratulations, and you're the first woman and the youngest person that you know of. You're
Yes.
38 years old.
Yes.
Wow, that's incredible, Andrea. So since you've taken on that role as CEO, what's your vision been like? How's it been going so far?
My vision for our community is to get back to why we were there. Many years ago when Tug River first started, we were in a tiny little house up on a hill. A lot of our providers did home visits, and it was a community clinic. And I want our patients in our community in McDowell and Wyoming, and now we're in Mercer, I want them to feel that when they come to Tug River. I want them to feel like it's home. I don't want them to feel like it's another clinic. I'm very passionate about population health and preventative medicine. And I want our patients to think about us when they get sick, when they're well. You know, I don't want it to just be, I'm sick, I need to go to the doctor. I want them to know that they can come to us all the time, and we'll keep them well so that they don't have to go to the emergency room and hopefully, you know, prevent admissions or long-term chronic diseases.
Right, and prevention can be key. Screenings are so important when it comes to health. So let's talk more about some of those passions and how you're using that to educate some of your coworkers and then also those who are coming to Tug River.
One of my favorite things, and I think one of the biggest things for population health, is what I call patient navigation. And I had a nurse at one point who, that was her sole job. When we had patients who had screenings come back abnormal, she would call the patient and we would actually navigate them through care, making sure they got to their specialist appointment, helping them overcome barriers such as transportation or expenses. And that model has really worked well. I was actually able to present that at one of the West Virginia Academy of Family Physician conferences in April, well, in Charleston, a couple years ago, and at the Coliseum. So that was pretty neat. I was one of their breakout sessions, so they got to choose whether or not that they came, and getting to present to a group of long-standing physicians on something I'm very passionate about was a big success for me.
Right, and that's a big deal to make sure that those folks do have their transportation and helping them through the process too. Well, Andrea, we have to take one quick break. We have much more to talk about. We'll be right back after this. Good morning once again, everyone. Welcome back to this edition of In Focus. This morning we're talking to Andrea Cline. She's the CEO of Tug River Health. Andrea, it's so great to have you here, especially during Women's History Month. Your story really is inspirational to others out there.
Thank you.
So let's chat a little bit more about what you're seeing as far as the healthcare industry in West Virginia, and specifically in our area of southern West Virginia, and the need for nurses right now too.
We do have a great need for nurses and providers, nurse practitioners, physicians. The pandemic really changed a lot of things for us. A lot of nurses in our area ventured out into travel nursing. They were getting paid a lot more money, and they were able to see a lot more, and so a lot of the nurses in our community took that route, which caused us to have a shortage of experienced nurses. So we're branching out, trying to try some new things. We've utilized medical assistants. I'm starting to hire some CNAs, so that way I can train them and bring them up a little differently. We have to think outside the box, you know, when it comes to nursing care right now.
Yeah, I can imagine, really, because the whole state is in need of nurses. And back to your story, how you were saying that, you know, you were raising your children, working doing school, grad school. What message would you have for others out there who maybe just are saying, you know what, I don't know if I can balance it all?
Don't let fear guide you. Very easily, many times in my life, I could have been afraid to finish or to go back to something I started. and doing things as challenging as a graduate program with kids involved and working full time, that's very easy to give up on because it requires a lot in a lot of areas. But I wanted my kids to see that you can persevere. You know, I wanted other young women to see no matter what that you choose to do, you can break that glass ceiling. That's right. You know, I'm in a male-dominated career. Not many women are CEOs at this age, much less break through that glass ceiling in 8 years, you know, almost 9 years. So I set my mind to something, and that's what I've accomplished.
Yeah, no, absolutely, and that's what you have to do, and hard work really does pay off as well. What message would you have for those young folks who are in college or maybe even in high school and they're thinking about a career in healthcare right now?
Healthcare is a great career, and just from my own personal experience, especially failing out of nursing school and then changing degrees, you don't always know what you want to be when you're in high school. So don't be afraid to change majors. Don't be afraid to try something different. And if you still have that desire for healthcare, go back to it because that's what you're really meant to do.
Yeah, exactly. And then just keep pushing forward. You may not know right now what you want to do, but get a mentor too. That can always go a long way. What would you like folks in our community to know about Tug River Health specifically?
We're working very hard to provide excellent care to all of the patients in our community. I'm very passionate about our patients receiving the care they need. I see a lot of challenges, especially with inflation the way it is. Patients having to choose whether they're going to see the doctor or a specialist or eat. And Tug River can be a resource for you so that you don't have to make that tough decision. We have resources available to help with cost of care, medications, and we have excellent staff so that they don't have to travel, and that way that they can eat and be healthy at the same time.
And you, like you said, you rose through the ranks within about 8 years. What's your vision looking ahead for the next 10, 15 years and beyond?
I plan on staying at Tug River. You know, that's my heart and soul. I want to bring other women up in our community and in our organization. I want people to see that you don't necessarily have to have a specific degree to be successful. It's important for me to bring those up in our community. And even men who want to come in and rise in the ranks, you know, I want to take them under my wing and teach them all that I've been taught. It's really important for me to do that for our community. So I want to focus on our staff. You know, I want Tug River to be a sustainable place, a place where we have, you know, nurses with tenure, where they enjoy coming to work and battling burnout, because that's a big issue right now in healthcare in general is burnout. And I want our patients to know that we're there for them, that they can call us at any time, and you know, we're a huge resource for them.
And let's talk about the importance of mentorship as well. You mentioned that the previous CEO, Tim, was really helpful to you. Why are those mentors so important in the industry that you're in healthcare?
Everything changes. You know, when Tim was a young CEO, the things that he encountered aren't the same things that I encounter. So I had to learn his way to learn my way. And while they're different, you know, our administrative styles were completely different. I now find myself doing things the way that he did them, even though sometimes I, you know, didn't always agree with him. I now find myself acting just like him, thinking like him, you know, administrating and, you know, leading people the way that he did because it worked.
And like you mentioned, shattering that glass ceiling for young women out there watching, that is so important too. So what advice would you give to young women in any industry or who are interested in any career, as we're in Women's History Month right now? What's the key to success for those young women?
Perseverance. Don't ever give up. It's very easy to succumb to that, to feeling like that you'll never be equal, you know, to some of your male colleagues. And you just have to keep pushing and learning. It's going to be a challenge. You have to think outside the box. You have to do some things a little differently than the men in your career do them. But in the end, if you keep persevering, you'll get there.
And what do you hope your legacy is at the end of the day?
Oh, man.
It's a tough one, right?
Yeah,
and we have a little bit over a minute left, so.
You know, for young girls and the women in our community, even young nurses, there's more to nursing than bedside nursing. You can make a difference in a lot of different capacities, and I've had to learn that. but to leave our community in better shape than what I found it. You know, healthcare-wise, I want all of our patients to have access to quality healthcare.
Right, and you can make a difference. Truly, it's one person at a time.
Yeah.
Andrea, I want to thank you so much for joining us on this edition of In Focus and sharing your story, and hopefully it inspired some young folks out there as well. And this show is about important people and events in the two Virginias, so if you ever have an idea for a segment, you can always send me an email. It's mzosh, Z-O-S-H, at WVVA.com. But that does it for this edition of In Focus. We'll see you all again next Sunday. We hope you have a great day.